Focus. Ideate. Innovate. Enable.
The World Health Organization has described obesity as a global epidemic and one of today's most blatantly visible yet neglected public health problems. India is barreling to a global health crisis with 135 million people being obese in the country as per a WHO report, and it's estimated that by 2030, 27.8% of worldwide obesity would be dictated by Indians, accounting for 5% of the global population. CNN-News18 and HCMCT Manipal Hospitals present Health First, Overcome Obesity, and today let's find out how India can tackle this emerging health crisis. Now, obesity has become a major health concern across the world. Diet plans, health clubs, and medical treatments are some of the fastest growing segments in the weight loss market. But is there really a magic pill to treat obesity? To answer this question and more, I'm joined by Dr. Randeep Vadhavan, HOD and consultant, GI, minimal access and bariatric surgery at CMCT Manipal Hospitals. Welcome to the show, Dr. Vadhavan.
Thank you for having me in the show.
So, Dr. Vadhavan, let me begin by asking you, as per WHO's findings, globally 39% of adults were overweight in 2016 and 13% were obese. And the number has only increased ever since. Now, I want you to tell our viewers what exactly is obesity and what causes it. People often mistake obesity with overweight. So are they the same thing? And how much do you think the urban environment, such as sedentary lifestyle, poor diet and so on, contribute to the risk of obesity among people?
If you look at India itself also has about 130 million who are obese or overweight, so India is no different than the rest of the world. At the same time, how do we define obesity? Obesity is defined by this body mass index, which is weight in kgs divided by the height in meter square. We have these apps everywhere, so you can just download those apps and calculate the obesity. 25 to 30 would be overweight, so less than 25 is normal. Generally in India, they take 2.5 BMI points less. So we may actually have 22.5 to be normal and anything above that to be overweight. More than 27.5 then would be obesity class 1. 32.5 would be obesity class 2. And beyond 37.5, as per Indian standards, would be morbid obesity. That is to suggest that these are the type of people who may develop multiple problems which are associated with obesity, like diabetes, hypertension, and so on. You also said that because of the environment, the obesity is on an increase, which is absolutely correct. Unfortunately, in India, we also find that it is not just confined to our urban population. Even in the rural population, it's on an increase, which is really unfortunate.
Right. So, Doctor, what according to you are some of the common consequences of being overweight or obese, and how do they differ in terms of age and gender?
So obesity is not just about the physical appearance, it's also associated with a lot of other medical conditions, primarily type 2 diabetes. Indians in any case, because of the genetic predisposition and because of the central obesity that they develop, they have higher chances of developing diabetes a lot earlier than the Caucasians. Then the other problems like hypertension, cardiovascular risks, certain cancers. So you said, what is the difference between males and the females? In females, particularly, the preponderance of breast cancers, endometrial and cervical cancers is a lot more, while in the men, it's probably mostly the colorectal cancers which are associated with obesity, apart from gastric and other cancers as well. Then reflux issues, patients having to get up at night just because they have that acid reflux coming up. In ladies, particularly the ones who are working in corporates, they tend to develop a sedentary lifestyle. They develop the PCODs and then leading to infertility issues. and that's why we find our growth rate decreasing in our part of the world.
Right, Dr. Vidhawan.
So before you ask me the next question, we have a beautiful facility here. Let's look at the other parts of the facility as well.
Sure, let's go.
Let's go.
So, doctor, you mentioned that exercise alone won't make any changes. You need to change your eating habits as well. So now I want to know from you, at what stage is the medical intervention needed?
Yeah, so the treatment works like a pyramid here. So like I said, between that BMIs of 25 to 30, we would generally suggest diet and lifestyle changes. More often than not, people would probably be able to do that. Just in case they're still not able to do, or they come in late between that segment of 30-35 BMIs, that's when we suggest that go for a medical treatment. These days, a lot of medical treatments are available. We call it pharmacotherapy, and that can take care of obesity at that stage. And yes, these pills and injections are available in the market, and we've been prescribing it pretty often. And the response is very good. But then in that segment of 30-35 BMIs only, once you increase that BMI, the person is still not careful, or the person reaches us late, that's when probably we would suggest some kind of a surgical intervention, but that would be beyond 35 BMI, not before that. And so medical therapy and lifestyle and diet would probably be the major component of treating obesity early. Late, then of course you don't have a choice except for surgical options.
Absolutely. And now, doctor, you have explained to us what obesity is, what are the causes, consequences. Now I want you to tell us, talk to us about the surgical and the non-surgical treatments that are available here at Manipal Hospital for people to get treated.
We are a center of excellence for obesity treatment, for bariatric and metabolic surgery. One of the recognized centers in the country, and we offer a gamut of treatment. So it's not, and like I said, it's a multidisciplinary treatment. So when the patient walks in, the first consult is that of a nutritionist. We advise the person that you must go for a good nutritional treatment, get your diet back, get your lifestyle back. But and also the second part, like we discussed earlier, is the psychological treatment of the mind. So treatment of the mind is extremely important. We at times feel that most of the obesity is to do with the mind, because you need to control your mind to getting back to your healthy habits. Dietary consults and the psychological consults are extremely important. So anyone with more than 35 BMIs, we would advise them surgical options. We again, in our own hospital, we are doing all kinds of procedures depending upon the age of the person, the sex, the eating habits, whether comorbidities are there or not there. Person is only looking at weight loss or also looking at resolution of all these comorbidities. Somebody at 60 years would get a different treatment than somebody at 18 years. So like we say that one shirt doesn't fit all. So we would offer all kinds of surgical options. And these surgical options, these days, we made it very simple and easy. The patient would generally, or the friend would generally come into the hospital and stay only for a couple of days, 2 days. Procedures would be anything from 1 to 1.5 hours, and they can pretty much go back to their normal life after 2 days, following a dietary advice which is given by the nutritionist. And most of these procedures are done laparoscopic, which is a keyhole surgery. We also offer robotic surgery, which is the next generation surgery, which is again through Da Vinci robot. Those are again, the recovery is a lot better, the pain factor is a lot less, and the patients can get back to their normal routine a lot faster. So we offer both laparoscopic, robotic, and procedures depending upon the problems that the patient has.
So definitely, doctor, there are a lot of treatments and procedures available here at Manipal Hospitals. Now, before I let you go, what is that one advice that you would like to give out to our viewers or everyone who's watching this program on how to maintain a healthy lifestyle, especially while dealing with the pressures of high-paced life?
We always feel that prophylaxis is better than treatment. So get back to your normal and healthy lifestyle is extremely, extremely important. We want a healthy India. So healthy India is extremely important. A healthy India is a better India, economically stronger India. So that is what we are looking at. But at the same time, I would say that the government of India also should start task force, particularly to ensure that we are getting down to the children. We are ensuring that the children become healthy, because we know that healthy children will become healthy adults, and obese children will invariably become obese adults. So we need to catch them young. We need to ensure that the task force or the patient or the awareness goes down right till the schools. Ensure that they have a healthy diet. Junk foods, yes, every child would like to have a junk food, but at the same time that should be limited. It should probably be limited to maybe once a week itself. TV viewing or computer viewing, general recommendation is it should be limited to only 1 hour a day. By and large, you would find them on the computer or on the watching the TV screens all the time. A healthy lifestyle in the form of just doing your walks. So what we find is, if somebody is doing, let's say, a 250 minutes of walk in a week, is going to maintain their weight. But somebody who wants to lose a bit of weight, then you need to escalate that to about 300 minutes of at least brisk walking or doing some kind of an exercise every week. So these are simple methods which can be done irrespective of the fact that our urban areas or our metros have become concrete jungles. But at the same time, we can do these simple things and follow a healthy lifestyle. And a healthy lifestyle, like I said, is a healthy India.
So healthy lifestyles would lead to healthy India. That's the key takeaway of the conversation. Thank you so much, Dr. Vidhavan. We wish you all the best for your future endeavors.
Thank you very much, and thank you very much for having me on the show.
We will now hear from Mr. Raman Bhaskar, Hospital Director at CMCT Manipal Hospitals, as he shares information about the various procedures and treatments undertaken by the bariatric department. Take a look.
Manipal Hospital is a 63-year-old organization, and we just in fact bought over Columbia Asia. So now we are 27 hospitals. We are the second largest group in the country now. In fact, a very interesting thing which I would like to tell you about how Manipal started is Dr. T.M.A. Pai, who is the owner who started Manipal, passed out from, he came from this village called Manipal. Once he finished his medicine, he went back to Manipal to treat patients. The first and most important thing about Manipal is a very ethical organization, and that is what has created the brand, the trust we have. In fact, even when we came in Delhi, people were not very sure because we are a very south-driven brand. But when we came to Manipal, Delhi, in last 5 years, in fact, we've been rated among the top 3 hospitals of Delhi by Outlook, which was a recent survey. And it is purely because of the excellence we have created. We give a lot of focus to patient centricity, ethical practice, and clinical excellence. In fact, these are our 3 pillars. Our hospital is designated as a center of excellence for bariatric surgery. Having said that, we don't want patients to keep coming and getting operated for bariatric surgery. That is where I said health check is important. Please get your health screenings done. Your weight can be controlled. It does not require surgical intervention. We have a beautiful system where we look at BMI, where it looks at fat on different parts of your body, because your every body does not have that much fat. So we have dietitians. So we do preventive care a lot. We do not just believe in doing surgical intervention. Of course, we do banding and so on and so forth. There are other surgical procedures we do in bariatric, and we are a bariatric excellence center. We started this hospital 5 years back, and since last 5 years we have been in bariatric surgery.
All right, those were the insights from Manipal Hospitals management. Up next, we have inspiring stories of patients who were under the care of Manipal Hospitals. Let's take a look at their weight loss journey.
मेरा नाम संजय लोहिया है और मैं दिल्ली आयनगर कर प्रॉपर स्थायी रूप से रहने वाला हूँ। हमारे यहाँ देहात है, गुजर, हम लोग शुरू से बिलोंग करते हैं, देसी खाना, देसी पहनना, तो गाय भैंस का घी, दूध और ये सब चीज़ ना शुद्ध यही चीज़ चलता था। और मैं खाने पे कंट्रोल था, नहीं खाया, सोया, बैठा, इतना हार्ड वर्क मैं कर नहीं पाया, तो उससे मेरा फैट बढ़ता बढ़ता इतना बढ़ता चला था कि बहुत ही ज़्यादा होगा और आउट ऑफ कंट्रोल था। वॉक करूँ तो सांस फूल जाए और बैठूँ तो बैठा ना जाए, सो जाऊँ, बहुत ज़्यादा घुटनों में दर्द, पैरों में दर्द, पूरा बहुत परेशानी। मैं उस चीज़ से बहुत परेशान आ रहा था। फिर मेरे को किसी ने, मेरे फ्रेंड ने सोल्यूशन दिया कि भाई आप ना किसी से कंसल्ट करो या जिम ज्वाइन करो या एक्सरसाइज करो, कुछ हो जाए। लेकिन मैंने बहुत मेहनत करी, नहीं कर पाया। फिर मेरे को डॉक्टर का नंबर मिला, रणदीप वाधवा जी का। मैंने उनसे कंसल्ट किया फ़ोन पे ही, तो उन्होंने बोला एक बार आओ मेरे से मिलो, फिर मैं आपको बताता हूँ कुछ। इसका है अभी बहुत अच्छी सी टेक्निक चल रही है, काम हो जाएगा अभी। मैं जब ना ड्राइव करता था तो बैठा बैठा ऑन सीट, ड्राइव सीट पे ही सो जाना, घर बैठा हूँ तो बैठा बैठा गिर जाना। मैं तो कई बार स्लीपिंग सोते सोते भी गिरा हूँ बेड से ना, उठा टॉयलेट के लिए जा रहा हूँ, बाथरूम के लिए, बाथरूम में खड़ा खड़ा सो जाता था, गिर पड़ता था। ये सारा अपन चीज़ हो रखा है ना, उसी चीज़ का है, बहुत ज़्यादा हो। बस मेरे को ना अब अंधेरा से ही नज़र आने लगा था, कुछ भी मेरे को लग ही नहीं रहा था कि किसी चीज़ में मतलब काम करने में कोई मतलब इंटरेस्ट नहीं रहा। हर टाइम यही प्रॉब्लम कि यार नींद आ रही है, नशे से हमेशा नींद का नशा। और दर्द हाथ पैर में, वेट इतना भारी, बाहर निकलो तो कपड़े का साइज बंद होगा, कपड़ा नहीं मिलता था मेरे साइज का कोई भी, शर्ट वर्ट सब इतने 4XL से भी प्लस चल रहा था बहुत ज़्यादा। अपनी लाइफ ना बिल्कुल बोरिंग थी। बस मेरे को लगा कि यार कुछ इसका इलाज कराऊं या तो किसी भी तरीके से कम हो जाए। एक्चुअली मैंने उनसे बात की थी, तो बात करने से पता चला कि उन्होंने बोला कि भाई एकदम से तो देख, मैं भी जादू की छड़ी तो है नहीं मेरे पास कि तू मेरे पास आया, मैंने तुझे दिखा दी छड़ी और तू बोला कि अगर मेरे ऊपर बिलीव है, भरोसा है। तो मैंने उनसे कई बार बातें भी की, मतलब सर ऐसा ना हो तो साइड इफेक्ट हो जाए, कोई ऐसा मेरे वेट इतना ज़्यादा कुछ दिक्कत ना हो जाए, प्रॉब्लम हो जाए बाद में। कोई घबराहट थी बहुत ज़्यादा, लेकिन उन्होंने मेरे को विश्वास दिलाया, कॉन्फिडेंस में दिया कि भाई ये जो मैं करूँगा मेरे भरोसे पे कराओ और बहुत अच्छी चीज़ है। और मैंने बहुत लोगों की किया, उन्होंने की भी है, काफ़ी लोगों को किया है उन्होंने। तो मैं देख कर फिर मेरे को लगा ठीक कह रहे हैं, तो मैंने जब तो 2 साल हो गई। तो मेरे हुआ है लॉकडाउन में ही किया हुआ था, लॉकडाउन में किया है मैंने, हुआ है मेरा ऑपरेशन। तो उस टाइम में मैं डॉक्टर से मेरे एक दिन फर्स्ट डे मैं जिस दिन उनसे मिला ना, बस उस दिन तो मेरे को उन्होंने कंसल्ट, भाई ये होगा, इस तरीके से होगा। 1-2 टेस्ट लिखे उन्होंने बॉडी के, जिस हिसाब से मेरा फैट था ना उस हिसाब से बोला 1-2 टेस्ट करा लो, फिर उसके बाद बताओ आप क्या करना है आप पे। तो मैं इस तरीके से, उन्होंने पूरा मुझे प्रैक्टिकली बताया कि भाई ये ऐसे होगा, इस तरीके से आप धीरे धीरे होते चले जाओगे। और अपने आप में एहसास होता चला था कि यार डाउन हो रहा है। फिर चेहरे पे नूर और बॉडी में एकदम खिंचावट, और फिर एकदम बॉडी में फुर्ती आती है ना, एनर्जी जो आती है। मेरे फ्रेंड मुझे पहचान नहीं पाते, रिश्तेदार मुझे देख लेते तो अचंभा मानते कि तो क्या हुआ भाई, एकदम से 150 किलो का आदमी और एकदम से 70 किलो का आ जाए तो थोड़ा फर्क पड़ता है ना। मैं कई पार्टियों में जाता था बीवी वाइफ के साथ, तो देखते नहीं सब हंसते थे, फ्रेंड लोग मजाक बनाते थे और जो मेरे को भी अच्छा नहीं लगता था जब मेरे बच्चों से कोई कुछ बोल रहा है कि "ओ, इसके पापा तो बहुत मोटे हैं, बहुत हेल्थी है और ये है वो है", तो मैं जाना पसंद नहीं करता। लेकिन अब हर जगह मैं साथ जाता हूँ।
Focus. Ideate. Innovate. Enable.